Hello and welcome to the Community Shares of Illinois interview sessions, the podcast where we give our members a chance to talk about their wonderful organizations and the meaningful work that they're doing. With us today, we have Claudia Lennhoff from the Champaign County Healthcare Consumers. How are you today, Claudia?
I'm good. Thank you so much for inviting me to be on here.
Well, thank you so much for being on. And so I'll kick things off. How long have you been with Champaign County Healthcare Consumers?
I've been employed at Champaign County Healthcare Consumers for 26 years this year. And prior to my employment, I was a volunteer for 2 years before that. So all in all, I've been with the organization for about 28 years.
Wow, that's great to hear. That's a nice experience to hear about.
Yeah. I couldn't have wished for a better job and a better way to to be able to serve the community. So I feel very fortunate.
Great, wonderful to hear. And so just in case any of our listeners or viewers out there aren't familiar, do you mind telling us a little bit about the work that you do there at Champaign County Healthcare Consumers?
Yes. So our organization has several different areas of work that we do. So one of the areas is around advocacy and community organizing. And that's where we work to make changes to improve the health of the community or to advocate for important legislation or important changes. And then the other side of our organization is involved with direct client services. And the specific services that we provide is we help people sign up for health insurance. We are experts in helping people sign up for Medicaid, Medicaid managed care plans, the Affordable Care Act marketplace plans with subsidies, as well as Medicare and Medicare managed care plans and Part D. And also, we're very knowledgeable about the programs that benefit low-income consumers, whether those are food stamps. So SNAP, we can help enroll people on SNAP. We can help assist them with LIHEAP, discounts at the Secretary of State. And then there's a whole range of Medicare-related programs that can really help low-income Medicare beneficiaries, such as Medicare Savings, Medicare Extra Help, also AABD, and things like that. We also help people sign up for disability. So that can be SSI or SSDI or both. And we also help people navigate the healthcare system. So if somebody needs assistance finding the right kind of provider or doctor, we can help them with that. Or if they need help finding affordable dental or vision care, we can assist with that. And so we really provide a whole range of services to individuals, and we really try to wrap around and identify every need that the person has. And then if it's not a service that we provide directly, we make warm referrals to other organizations that help with that service.
Great. That's a nice long list of services you've got there,
Yeah.
Which kind of leads me into my next question, because I like to do it as a bit of an icebreaker and say, do you have a favorite part of that work that you do there that just you're really excited about? Because I know you've got so many different wonderful things you're doing. Is there a favorite part?
Yeah, I can mention two things. The first thing is that anytime we help somebody get a new benefit that they can use that helps improve their lives, it's always a happy experience. And clients are really warm and generous and grateful. And one of the things that I really love is once we've helped somebody, a lot of times they help other people find their way to us so that we can provide that kind of assistance. So it's very, very gratifying. The other thing that I can tell you is that a really big moment for me personally, just because of my longevity with the organization, was when the Affordable Care Act was passed. And then in the state of Illinois, Medicaid was expanded, and there was also the marketplace with subsidies. And we were able to enroll people in health insurance who previously before the Affordable Care Act, they would not have had the option of having coverage. And when people didn't have coverage because they couldn't afford it or they had a pre-existing condition or something, they went without the care that they needed. And that's really dangerous. It's really, really important for people to get regular preventive care, establish with a primary care provider, and just stay on top of their healthcare needs. And so it was an incredible relief when the Affordable Care Act was passed, and our work really shifted towards enrollment instead of just troubleshooting crisis situations. Before the Affordable Care Act, a lot of my time spent helping consumers was actually spent finding and begging doctors to take a patient, even though they were uninsured and wouldn't be able to pay a bill. And there were many wonderful doctors who stepped up to do that, but that's not the answer. The answer is making sure that people get covered, and then that coverage is like a passport to care. And so ever since the passage of the Affordable Care Act, the nature of our work has really changed, and we're seeing people earlier on in their process of getting health care than what we were in the past. And so there are so many more hopeful outcomes from that. And I just will never forget that change, because I remember the dark days before the Affordable Care Act.
Oh, yes. I must say, not to make things personal for the interviewer here, but yes, the Affordable Care Act is very, very important to a lot of us.
Yeah, well, and one of the things that we tried to explain to people, just so that they would know, is especially in like Champaign, Urbana, and throughout the county, there's so many people who work in the service sector, where maybe they're working at a restaurant or a bar, or they're cutting hair, or, any number of jobs like that. And those are typically low wage jobs that, maybe a person could make a living, but they couldn't afford health insurance. And so those were some of the very first people that we reached out to, even just around our office in downtown Champaign, to give them the good news. And so we started seeing, some of the baristas from the coffee shop, or, waitresses and waiters. And that was really exciting.
That's great. That's wonderful to hear about. That was a big change for you. And I'm glad you're here to help those people with that.
Thank you.
So kind of going on, I wanted to give you a chance. Is there anything new going on? Any upcoming events, plans that Champaign County Healthcare Consumers has going on forward?
So one of the changes at Champaign County Healthcare Consumers in recent months is that we have developed a really robust program for helping people apply for disability. So SSI and SSDI, we have 3 new staff members, now very experienced, who are working to help people apply for disability. And so that is something relatively new this year that we want people to know about. The second thing that I wanted to mention is that fall, which is coming up pretty quick, fall is typically open enrollment season for Medicare related plans, like Medicare Advantage plans, Medicare Part D, and so on, as well as open enrollment season for the Affordable Care Act marketplace health insurance. So if anybody will be needing help with that, healthcare consumers will stand ready to help, and we'll be doing a lot of outreach around that. The third thing that I wanted to mention is actually a partnership project that we have been working on with Carl and the U of I to create Hope Village, which is a tiny homes village specifically designed for people who have been chronically homeless and who are medically fragile. And we will have 30 homes. It's not built yet. They just started moving dirt on the site, but we are very, very excited about that project. And that was designed specifically to help individuals who are homeless, who were kind of falling through the cracks in our local housing system, and who need a lot more support around them in order for them to be able to have a home, keep a home, get healthier, and live more comfortably. And so that is something that we are extremely excited about.
Yeah, that's exciting news. Yeah. Glad to hear it here.
Yeah.
And so now this is the shameless part for me, but to promote Community Shares, I do like to ask, do you have a favorite part about being a member of Community Shares of Illinois?
I do. We've been a part of Community Shares since the inception of Community Shares. And there are several things that I really love about Community Shares. First of all, for us as an organization, it helps us have a greater reach to donors who we may not have connected with in some other way and who maybe didn't know about our organization and the services that we provide. So I think that it is a really great way to expand one's reach, both in terms of information about the organization, so people know we're here and what we do, but also to help establish a donor base that is very consistent and very regular. And the other thing that I also really like is being part of Community Shares with many other local organizations. So we learn about other organizations and we can connect to them. And, it's just, it's kind of really a community. It's in the name. I know that's not the specific intention of the name, but within the organizations that are members, we also have our own community of organizations. And I'm very, very grateful to the donors who have chosen to contribute to Champaign County healthcare consumers through the workplace, through Community Shares of Illinois.
Well, and thank you for that. But also, since you mentioned donors, we'll close things up with our last question here and give you a chance to tell everybody out there about all the wonderful things that donors can help with, any donations, if there's any volunteer stuff you need. I'll give you a chance. Just let them know what they can do.
Thank you. There are two big things that really come to my mind. The first is, of course, the financial contributions and the consistent donations that really are helpful to the organization. One of the reasons that those donations in particular are very helpful is because they go to the organization without strings attached for a very specific item or service. So we can deploy those contributions to the best effect for our organization and our mission. And so that is really helpful when people make contributions through Community Shares. The other thing is, as they learn about our organization and the services that we provide, the other way that they can help is by getting the word out and letting people know, especially in Champaign County, if you need help with health insurance or SNAP, or you have a healthcare problem and you don't know how to resolve it or where to get help, you can go to Champaign County Healthcare Consumers. So helping to spread awareness about our organization and our services is also another big help to us.
Well, there you go. And so everybody out there listening, watching, I want to say, go out there, get as much help as you can to Champaign County healthcare consumers. Like Claudia said, they've been with us at Community Shares for a very long time, and we love having them. So definitely get out there and help them. Look them up. You can also go to our website, communitysharesillinois.org. We have links to their website as well as our other members. But with that, I want to take one last time and thank you, Claudia, for being on with us today. It was wonderful hearing about all of that great work you're doing, helping out in Champaign County.
Thank you, Andrew. I really appreciate it. And to the donors out there, I just want to say a really big thank you. We really, really appreciate y'all.
All right. And with that, I'll close things out, and we'll see you here next time on the Community Shares of Illinois interview sessions.